Here we go again with Dr. Mahoney, a DO who treats people with not necessarily with drugs, only if it is needed, as he's well qualified as a doctor to do so. But he looks for ways of treating the cause and treating it with as little as possible of narcotics. Now, Dr. Mahoney, what is your clientele, your patients? What do they mostly come to you? What is the one, two, or three things you mostly treat? The type of pain people have a hell of a time getting rid of, and yet you can help.
Well, besides heartache, that pain, probably the biggest problem that we find in our practice that we can fix is people who have pain that's caused by low thyroid levels. People don't ever think of the thyroid as causing pain, but people with lupus or arthritis or a chronic fatigue syndrome or fibromyalgia, there's a tremendous amount of benefit to having your thyroid carefully investigated. And most of our patients will say, I had that looked at and it's fine. My doctor said it's fine. And I say, well, what tests did they do? How did they evaluate your thyroid? And they'll say, well, they did a TSH, a thyroid stimulating hormone test. And I said, well, what was the number? And they said, I don't know. He said it was normal. And that does not have enough diagnostic value for it to be different. So thyroid is number one. Number two is men with testosterone problems. They're weak. They become less muscular. They have joint damage because their testosterone is low. And when we replace that, they get much better. And finally, people who eat a horrible diet with a lot of sugar in it causes inflammation, and that inflammation causes joint and muscle pain. And we work on all those levels, nutritionally, hormonally, and really in a great number of cases emotionally, to help people to understand that the emotion that they're experiencing in their relationships or the choices that they're making, it influences their pain.
Oh, I'm very, very sure it does. In fact, I'm married about 23 some years now, and the first 5-6 years, my wife, when I was sitting at the kitchen table or driving in the car and I was like quiet and not talking to her, she would think I'm upset with her. And then it took about that long to figure out and to then point it out to me. There was nothing wrong with me not liking her. I was just tired. And when you're tired, your whole emotion, everything goes by the wayside. It just, you look like an unhappy person, and for all purpose you do feel unhappy. So I can see where energy level is important. Now let me ask you, what type of symptoms, for instance, with the thyroids, you put a lot of attention on it. What type of besides of taking the tests, but what type of symptoms a person would experience when his thyroids are out wacko, not quite where they should be?
Probably the most important thing to realize is that symptoms are just as important as the numbers, so that if someone has good numbers and their doctor says your thyroid's fine, it doesn't necessarily mean that that's true. What really comes up is that people who are cold-natured, everyone else in the room is wearing just a light shirt, and they need a jacket and a blanket and a hat and a scarf, and they're miserable and cold all the time. That's gigantic. Their bowels don't work well. They're always a little hard to go, and that doesn't work. They feel most of the time like their skin's too dry, and that doesn't feel good. Their energy level's low. They wake up in the morning, they're tired, and then when they get going during the day, they have 2 or 3, maybe 5 good hours, and they're tired in the afternoon. Then they don't sleep real well at night, and then they don't get rested, like you said, and then everybody around you is wondering, what's wrong? Is there something? Are you upset? So the symptom complex of thyroid is enormously important. And most doctors that I work with, they're thinking about other things. They're thinking about sore throats or urology or whatever their specialty is. So thyroid issues are not thought of. Once the numbers look good, doctors don't think behind that. I have another colleague, she said, she has a seminar she does that says, if my tests are so good, why do I feel so bad? And she is interested in thyroid as well. And we work together to discover why are those symptoms such a big deal. And once we get them resolved, patients will always tell us the same story. I feel good now. I feel like somebody turned the lights on.
Wonderful. So basically a person has an itchy, dry, scratchy skin. Maybe the dermatologist isn't the place to go.
Well, and that's part of the deal that we do. We will look at a patient from every perspective, hormonally, emotionally, immune system, their structure, their family, their medicines, all of that, and decide what is probably causing the problem and how can we remove some of those problems so we can make the patient feel better and better. Because as a patient feels better, they become more healthy, you can't be healthy and sick at the same time. So the healthier you get, the less sick you will be. And eventually, the symptoms that you have that are causing you to come see the doctor, pain or fatigue or whatever it is, those go away. And eventually, unfortunately for me, I have to find new patients all the time because my patients get well and go away.
Well, you said that you cannot be healthy and sick at the same time. It's kind of like you're pregnant or you're not, right?
Right.
But let me ask you something. Do we as patients, and maybe even many doctors, have we started accepting a sub-level of what we call normal? You know, kind of like we think that it is normal to get tired at 4 o'clock in the afternoon. We think that it is okay to be grouchy, God only knows when, where, what. We think that it is okay to have 3 colds a year. That we think, well, that's not really sick, that's normal. And so we're accepting I'm healthy when we're really like, we're not. We already are sick. Is that a possibility?
I think that's a fair way to look at it. What I've always said to people is aging is not getting joint pain and feeling weak and not being able to function. That's a sign of sickness. That's not a sign of aging. Aging should be something that you get smarter and you make better decisions and you're clearer about who you are, but you shouldn't dwindle down and have illness all the time and joint pain. And so I think what people have been told is that it's a normal part of life to fall apart. And I don't think that that's true. And I think from my experience, and my patients will tell you this as well, they come in and say, boy, before I saw you, I thought I was falling apart and my world was degrading. And now I realize that there's a much higher level to live at. And people will get used to living at 40% and think that's normal. Then I bring them up to 80% or 90%. That becomes normal for them. And when they go back to 70%, they're very clear that they're not doing as well. And they want to improve again by taking hormonal therapy or changing their diet or changing their nutrition, something. So, yeah, I agree with you completely on that.
Okay, good. So, and that is something that I kept. Now, for instance, let's go back to the thyroid since so as you fix the thyroid, so people have like fatigue, I guess they can have all kinds of symptoms, but like cold, feeling cold, all those already things which start to kind of having some indication that there might be something wrong with the thyroid. What's going to happen if it gets more advanced? So you have that for a year, 2, 3, a decade maybe, and you didn't take care of it. What are some of the more advanced stages which are going to happen?
Well, I think what people don't really understand is that there's 50 million or more people in the United States with thyroid problems that have not been properly treated or diagnosed. So it's a gigantic problem. And depression, in my opinion, the number one cause of depression that's not diagnosed for the real cause is low thyroid function. The numbers might be okay or close to okay, but generally someone with bad thyroid function, they're going to start to become so depressed that they'll get on medication for depression. And that medication for depression causes all sorts of secondary side effects that go with those medications. Dizziness, weakness, weight loss, weight gain, problems with intimacy, those kinds of things. And as they progress, those patients become the multi-drugged patients who come to see me, and we find a root cause of it. Possibly it's thyroid, possibly it's other hormones, possibly it's immune, and we get to those root causes, and we can pull all those medicines over time with the help of their other doctors out of their regimen, and now they can be either drug-free or very close to it, taking some hormones that are natural, bioidentical, or natural hormones of another kind, and they'll get well, and they'll get better and better and better, and their life will improve. I see 80-year-old people who are together, and they're able to be intimate together and enjoy their life, and they're vibrant and healthy. They have a lot of questions, but that's the worst problem they have. Wonderful.
So basically, fixing the wrong thing obviously just accelerates the dwindling spiral.
Absolutely. Because you missed the point. It's if you're driving down the street and you see a stop sign, a symptom, and you don't want to stop, and you run that stop sign, you keep running the stop signs, you're going to get hit eventually. And what we try to do is say, pay attention to the stop signs. If you have an achy joint, or if you're tired at 4 o'clock in the afternoon, there's something wrong. Now, maybe we can fix it and maybe we can't, but we certainly don't want to avoid looking at the symptom as part of the whole picture of getting someone well, because when they can wake up and be bright and shiny in the morning and 4 o'clock in the afternoon they still feel good, they're a much better person for it, and they feel better and they're happier, and their disease process is either arrested or reversed.
Wow. And fixing those thyroids, since we are on them, doesn't mean any surgery. It doesn't mean taking chemical drugs. And how long does it more or less take to kind of see some, like you just said, you get them from 40 to 80% or whatever it may be. How long does that take? A month, a week, a year?
Well, with a thyroid patient who's been treated either not optimally or not at all, within several days. And what they say, and I've had many patients say this, is it's like somebody turned the light on. They wake up and they can feel the difference. And I think because our environment is so toxic and becoming more so, patients tend to have more thyroid disease than they had in the past. And I think it's very mild, but it's strong enough that with all the demands that are on you and me and everyone we know, you need to have excellent function in order to function at all adequately in the world that we're in. So when they take thyroid treatment, it doesn't take them long, usually less than a week, before they know something has changed. To go from 40% to 80%, there's probably more than just thyroid there. There's nutrition and other issues. So that might take maybe a few months, but we're pretty successful. And lots of our patients go from a level of very low function to a high level of function within a few months.
Well, I can only imagine, frankly, as I said, the example with my wife, that she's unhappy when I'm not talkative and all I am is tired. And when that happens, the funny thing is, I don't even know that I'm on diet. I'm saying, no, I'm fine. No, honey, nothing wrong. No, I'm fine. I think the overall happiness of having energy, because it is true, when you have energy, the color, everything looks brighter, everything looks more wonderful. And here's what I found. People with energy, they have ideas, money-making ideas, name it. They because it's difficult to come up with some plan and idea when you're exhausted.
Yeah, well, in my opinion, in my experience, my patients, lots of them, they're about 35 to 60, 70 years old, and one of their big concerns is that their relationships, their intimate relationships, their sexual life is really dramatically inhibited by the fact that they're exhausted all the time. So the question is, well, what do I need to do about that? I said, well, why don't we take care of your energy level? Because if your energy's higher, not only will you be creative with ideas that would make money and build buildings, but it will also give you the opportunity to be more creative with your intimate relationships and the intimacy that you have with people and the depth of relationship you can develop. Because when you're tired, you just don't want to. I'd rather just go to sleep. I don't want to get involved in all that. Right. And boy, it is very, very gratifying to have a patient come in who's 80 pounds overweight and sick and tired, and then come back, 3, 4, 5 months later, and they're thin or much thinner and much happier, and they just are so thankful. It's just wonderful.
I keep telling you about the things they did, the cruise they took, the new business they took on, the new promotion they got, and whatever. All kind of, it looks like out of the blue, but really simply because they were energetic and happy, and people like to deal with energetic and happy people. Wonderful. Yep. Well, Dr. Mahoney, we've got to end this off here. We have way overstated our welcome here on this camera. So thanks, and this is very, very informative. We'll talk more about it. Bye-bye.
Thank you.